Hi, my name is Lauren and I work with a group of student educators. The purpose of this video is to educate you, the audience, on the diagnosis and treatment of hypertension. We videotaped a mock doctor's appointment in order to show you a typical doctor-patient interaction. Chelsea will be playing the doctor and Laura will be playing the patient.
Hi Laura, I wanted to talk to you about your hypertension today. When I took your blood pressure earlier, it was 150/100.
I'm not really sure I understand what hypertension is. Could you explain that to me?
Sure, so hypertension is high blood pressure, and blood pressure is the force of the blood pushing against the arteries inside your body, and the harder your heart pumps and the narrower your blood vessels are, the higher your blood pressure rises. And over time, this wear and tear can cause a lot of damage to your blood vessels and organs.
So how high am I? What's a normal blood pressure?
A normal blood pressure is 120/80.
So what's causing this? I'm not overweight. I don't understand how I could have hypertension.
Well, there are many risk factors for high blood pressure, and being overweight is one of them. Smoking, drugs, and alcohol, and kidney disease are also risk factors, and I don't think you have kidney disease, so do you smoke or consume alcohol?
No, I don't. I can't see how I possibly have hypertension.
Well, actually, one of the greatest risk factors for hypertension is a poor diet and sedentary lifestyle. What are your eating habits like, and do you exercise?
Well, I wouldn't say I have a great diet, but I have vegetables on my pizza, and I don't really exercise. I just don't have time.
Okay, well, I think we found the problem. Our blood pressure naturally increases with age, so as you get older, it's important to control your diet and to try and keep active. Unfortunately, adding vegetables to your pizza does not help the fact that you're consuming foods high in salt and fats, which can contribute to your high blood pressure.
So what do I have to do? Do I have to be on a prescription or something?
No, not necessarily. I think that your hypertension is greatly due to your diet, so we can start by trying to fix that, and if that doesn't work, then we can try a medication. Things you can do excuse me, are to try and keep physically active, keep your stress levels down, and in terms of your diet, try to eat fresh fruits and vegetables and avoid saturated fats and cholesterol like chicken and fish. And always avoid salt because that also increases your blood pressure.
That's a lot of things. I'm not sure that I could do that.
Well, I'm going to set you up with a nutritionist, and she'll meet you at Acme later today.
Great, thank you.
So instead of just adding vegetables to your pizza, you want to add vegetables to everything. You want to put it on the side of your plate. So this is where you're going to get a lot of your food. You're going to get vegetables from the side here that are all fresh and new. They haven't been sitting around a lot, so they're going to have a lot of nutrients for you. You're going to eat a lot of fruit that have a lot of vitamins for you. They're going to help lower that blood pressure, lower the cholesterol. Okay, so I want to eat vegetables, I want to eat fruit. Is there anything else that I would eat? Basically anything that's on the perimeter of the store will be good for you. You want to stay away from stuff in the middle like the canned stuff. You want to stay away from the packaged stuff that's high in salt. Anything that you really like to eat all the time?
I like chicken, but I like fried chicken.
Okay. You really don't like fried chicken. Have you ever tried like baking it?
I haven't.
Why don't we get some chicken that you can bake, and we can try some like nice like herbs or nice like seasonings that don't include salt, and try that.
Okay.
Okay, so remember how we talked about having the chicken and baking the chicken? Well, we want to make sure we're sticking with the chicken over any type of red meat, like not having steak.
So is bacon bad too?
We don't really want any bacon. That has a lot of salt as well. You know, all that grease that comes off of it.
Okay.
So we want to stick with like the chicken or the fish, any type of meat that's going to be a little bit lighter in color.
Okay.
Do you ever eat canned soup?
Yeah, I really like soup.
Okay. So one of the things canned soup has is a lot of salt, which is what's pushing that blood pressure up. So this one has 690 milligrams. This one only has 410.
Okay.
So we want to go with things that say healthy. We want to go with things that say low sodium or less sodium.
So where do I find that on the can?
So on the back here, it'll say nutrition. And you want to go down to the sodium. See how it says
Right.
410? And you want to make sure that overall your diet's not exceeding 1,500 milligrams a day.
Okay.
So see how the lower is going to help you?
Yes. Okay, thanks.
Are you up for trying new kinds of bread?
Well, I really like white bread.
Okay. Do you want to try wheat bread, or are you really, really committed to the
I
white?
really like white bread.
Okay, well, why don't we try this whole grain white? Because regular white bread has a lot of sugar in it that's not going to help you at all. But this white bread that's whole grain white is a little bit better for you.
Okay, I think I can do that.
So for snacks, do you eat like chips or crackers or
I
like?
really like crackers. I like the salty crackers.
Okay. See, like keyword salt. We don't really want the salt. So again, like the bread, you kind of want to stick to the multigrain ones. Over like the Cheez-Its, have a lot of salt, have a lot of cheese. If you go like your soups again and look for the sodium, you're gonna want to look and make sure you're getting things with the lower sodium. See how this one only has 220, whereas this one's 250.
Okay.
So, and just anything that's multi-grain is going to be better for you overall.
Okay.
So you willing to try this one? Yes, I can do that. So these are 2 different milks. What kind of milk do you normally drink?
I like 2%.
Okay, so we're not going to drop you down to skim milk. A lot of people says that it's water, especially coming from 2%. But why don't we try 1%? You won't really notice the difference. But 2% milk has almost twice as much fat in it as 1%.
Okay.
So we're going to try 1%. You're not really going to notice it, but you're going to have a whole lot less fat, which is going to be healthier for you.
That sounds good to